Good morning, everyone, and thank you for joining us today. I'm Dr. Velasquez, Health Officer for Spokane County, and today I'm joined by Kayla Myers, whom you've seen in this show before, who's our Immunizations Assessment and Promotion Program Coordinator. It's a very long title because she has a lot of responsibilities. Before we go there, I just want to take a moment and again acknowledge the heartbreak of many because of the wildfires, and also thank all of the firefighters, first responders, the team here, and all the teams that are working very diligently to make sure that we can bring people back home safely. And as you know, we have been able to return some folks back home. We're still working on some of the more impacted areas, and that will take a little bit. So we're doing everything we can, and we'll continue doing everything we can to be part of that effort. So one of the things that we haven't maybe thought about much lately is that as time goes on, school will start. And it's one of those things that we have to be ready for. And we thought it would be a good idea to talk a little bit about immunizations as we start to think about school, because I know people have been somewhat preoccupied, rightfully so, with many other things. But a couple of things just to help the community, and thank you for coming. Do we know if immunization requirements, vaccines may be waived for people that may have been impacted in this place and are able to have everything together?
Yeah, so I reached out to the Spokane Public School District and Meade School District,
Okay.
and at this time there is no plan to delay any of the required health documents
Okay.
or immunizations. However, they do have some great access points that we can go over and that are available for students and families who may not be able to get into the doctor before school starts.
Okay. So what if I lost my immunization records?
They also are prepared for that. They are instructing families to either try to reach out to the school that their child will be attending, or if they have access to a mobile device that with apps, they can try to find their child's record on My IR, which will be a link that we'll share. And they also can reach out to us at the health district, so we can provide some contact information if they would like to do that as well. The school district or the school that their child will go to might have a better idea of exactly what their child is due for based on information they have in their system, but they can also reach out to us for that information. We can help guide them.
Okay. And I always like to remind people that we have a lot of resources that we're able to share and help with. So don't forget that you can reach out to us and we can help you. Now, I do know that a lot of people have been impacted one way or another by the fires, and that probably includes a lot of our pediatricians and providers.
Yes.
So a common question is probably, well, my pediatrician or my family practitioner is not going to be able to see us for immunizations because they have been impacted too. What options do we have?
Yeah, we are aware of, I think, about 6 clinics that had to waste all their vaccine because of being evacuated. So this is great to bring up. The Spokane Public School District has a series of school-based health centers that are ran by CHAZ, and we'll put up a list, but they're at Rogers High School, Shadle Park High School, North Central High School, and Ferris High School. And also within Spokane Public School Districts is the WSU Health School-Based Center at Logan Elementary. So we'll provide links on how to access those as well, and directions for where to go when school is closed, because they are still open when the school is closed. If you're in the Meade School District, CHAZ also has a school-based health center in Shiloh Elementary. So there'll be information on how to access that as well.
So we have, sounds like we have multiple strategically located geographical clinics or services that may be available. Are there any other vaccine clinics that are happening?
Yes, so our team is putting on 3 clinics in the next week. We will be at Shaw Middle School tomorrow from 3 p.m. to 6 p.m. And we'll be also up in Deer Park High School from 3 p.m. to 6 p.m. next Monday, August 17th. And then we're also going to have a booth at the Magi Rising Village of Care event on August 22nd, and we'll be there, it's at Liberty Park, and we'll be there from 11 a.m. to 3 p.m.
Okay, so multiple clinics, and that's going to be on our website. People can go
Correct.
and look at it. So sometimes people say, can anybody go to those? Do I need to have insurance? How does it work?
Yeah, so any child that is under the age of 19 can come to our clinics and get vaccination services. Any uninsured adult 19 years and older will also have access to some limited vaccines available for them.
Those that are more appropriate
State-funded.
for the various age groups.
Yes.
Because a reminder, I'm glad you mentioned adults, because people, when they say immunization, everybody thinks about
Children.
children,
Yeah.
which is appropriate. But those of us that are over 18 by a couple of years do have some recommended immunizations over our lifetime, and that's something that I always tell people. Don't forget to ask your primary care provider when you go for your annual checkup. What am I do? Although I do have to say providers are really good at preemptively sending you. You should be scheduling. I know because my provider sent me a couple
Same.
when I was a little bit behind, but it's been crazy. But so we do have some services available at the schools that people can go to. We have some clinics that we're going to sponsor. If they have any other questions, any other issues, what else do you think people may want to know about this as we get closer to school?
I do want to just say, we understand that this is probably the last thing on people's minds right now as they've been through this difficult time. However, we do want to try to prevent any of the vaccine preventable diseases and outbreaks in our schools, especially as the school year gets started.
Right.
And that's just another layer that we don't want to add on top of the stress that families are feeling right now. So we are mindful of what a good portion of our community is going through, but it is still something that we think should be prioritized. And so we hope that these access points will make it easy for them to
Okay.
finish that part of getting their kid ready for school.
Yeah, totally understandable that many of us may not have been thinking about it
No.
because there's other things that were. But as school will begin at some point in the next several weeks, when I say that, children are not happy with me, but I don't set the schedule. We do need to think about making sure that they can go back to school safely, and we don't have other issues that may have an impact on the school year,
Yes.
because that school is very important. So, any last thoughts that you want to share with the community before we go?
Just don't hesitate to reach out to one of those resources. We want to make this part less stressful. So getting access to records that may be gone, finding access points, don't hesitate to reach out to us.
Okay. And I want to reinforce what you just said. This is not about you have to show up with the records, you have to have 27 requirements. This is about if you need it or you think you need it, contact us, contact the schools, show up, and we'll be able to help you and make sure that you get what you need for your children and for adults, depending on what the vaccines are. So with that, I want to say thank you to Kayla and our team, because we are all focused on the response, but at the same time, we're also focused on the things that we do have to take care of every day, and this is one of those. So don't forget, school will start eventually over the next several weeks, and can't believe I'm saying that, but and children will need their immunizations at this point in time. If there's an update on that, or there is any waiver or any changes in what the requirements are for the schools before the beginning of the school year, we'll certainly come back and update, right?
Correct.
Okay. Well, thank you, Kayla. Thank you to the team upstairs. Thank you to our providers out in the school clinics at CHAS, WSU, and many of the other folks that work with our K through 12 partners, and also to our K through 12 partners. Just remember, stay safe, stay well. We're thinking about you, and we're encouraged a little bit by. I saw blue sky yesterday, at least for a little bit, for the first time in about 10 days. So I think that's wonderful. So let's stay positive, let's stay together, let's take care of each other, and reach out to those that have been impacted and offer your hand and your assistance. Sometimes it's as simple as just having someone that cares. So with that, I'm going to say thank you. We'll see you again next Wednesday. Stay safe and stay well. Thank you.